Hi, my name is Brad Rogers and I'm the CEO of Bluelight Analytics. As a dentist, there's a lot of pressure for you to provide quality care while managing your costs, and sacrificing one for the other is really not an option. At Bluelight Analytics, we're here to help you achieve both.
Restorations account for about 60% of dental work, so the quality of your restoration directly impacts the profitability and reputation of your practice. A lot goes into a restoration, from preparing the tooth, to applying the bonding agent, to placing the correct increment of composite. Every step is important, and every step requires care in the planning and execution. When it comes time to cure, the common practice is to turn the light on, hold it over the restoration for 20 seconds, and consider it a success. But what if your light isn't working to your expectations? Or what if your material has a specification you didn't consider? Every day in your clinic, you make complex decisions on behalf of your patients using the information at hand and your own experience. Performing a restoration is one of these key complex decisions.
Dental materials vary from manufacturer to manufacturer and require different amounts of energy to polymerize based off of their increment depth and shade. To have a successful restoration, it is really critical that you follow the manufacturer's instructions for use. And to do this, you really do need to know how your light is performing and how much energy it emits. Now, every light will degrade over time. Even the best quality lights, as you're using curing lights day in, day out, material can get stuck to them, they can get dropped or damaged or chipped. Not every curing light performs the same in each of the different clinical situations. How you actually use your lights is really important, so you can really, in a predictive nature, make sure you're delivering enough light energy. People always tell me, well, how often should I check my light? And I say, well, how often would you want to go without discovering that there was an issue? Do you want to see 10 patients, 50 patients before all of a sudden you figure out all of the calls you're getting the next day around sensitivity or issues was related to this curing light? Let's talk about something that is top of mind for all dental professionals these days. Infection control barriers. Not only do they keep material from sticking to the tip, but they do affect the light output. So at 5 millimeters, you could have lost half of your intensity, needing to double the curing time. And so that's why it's really important that if you're using your infection control barrier, that you've tested your light to know what its effect is. The American and Canadian Dental Association recommend regular testing of your curing lights. And so although it might seem time-consuming or burdensome, that investment can really mitigate potentially redoing a restoration or 10 restorations.
When restorations are cured properly, they last longer and you reduce the risk of post-op sensitivity. This results in happier patients that will return again and again. Light curing is more complex than it might seem. The characteristics of your material and the performance of your curing light are crucial parts of the equation. There are 4 key things to know when performing a restoration: the energy requirements of your materials, your curing light's output, the best technique for operating your curing light, and the location, size, and depth of your restoration. You want to be a dentist first, but you're also a business person, and restorations account for a large portion of your revenue. Get them right, and your bottom line will benefit. Get them wrong, and you may have to repeat a procedure for free. Testing your lights can save you money by eliminating a possible element of failure and making sure your equipment is working as expected.
We're a technology company that started out with a deep understanding of the measurement of light energy, but over time we've grown into much more. We combine our expertise with the world's largest data set of curing light measurements to bring data-driven innovations into dental clinics. Our products help you get the most out of your lights and materials, providing information critical to performing restorations that last.
Checkmark has been actively used in the market for over 5 years and is a key element in providing accessible curing light testing. Checkmark takes the output of the curing light, combines it with the material's instructions for use, and gives the dentist a comprehensive report. This report shows you how long to cure the composite, at what increment, and which parameters to consider. Bluelight Analytics reviews each test for accuracy. This is so much more than a light test. It really is a revolution in dentistry. The checkmark test provides you actionable insights on your lights and materials that directly support your restorations. Bluelight is excited to announce CheckUp, the world's first and only light testing device powered by artificial intelligence. An expansion on the checkmark service, CheckUp is available chairside and it's a Bluetooth-enabled solution that allows you to get information on demand by testing daily or before every procedure. And you can sync this information with your smartphone or tablet and track your results across multiple devices in your office. If you already test your lights with a radiometer, then you're familiar with that standalone irradiance number. CheckUp can expand on this and give you context to those results. It measures all types of curing lights, accounting for different modes, wavelengths, and tip diameters. It records a light's test history and tracks any degradation over time. It stores and interprets light and material instructions for use and uses them to calculate optimal curing times for your specific dental materials. You can connect multiple users and clinics so you can collaborate across your organization or whole dental networks. All of these features reduce your workload without sacrificing your standards. CheckUp by Bluelight is independently validated to be the most accurate radiometer on the market, and we're improving it daily, helping you provide the highest standard of care with the best technology available.
Bluelight Analytics is on a mission. We want better outcomes for you, your business, and your patients. Our team is committed to continuous innovation in developing the solutions you need to achieve great outcomes in your practice every single day.